My name is Dr. Joseph McHale. I'm a hematologist at the Translational Genomics Research Institute and the Chief Medical Officer of the International Myeloma Foundation. We've had another extraordinary ASH meeting with lots of great research presented regarding multiple myeloma, and I'd like to focus on 3 abstracts today related to the agent Ixazomib that we use extensively in multiple myeloma. The first of these 3 was a phase 3 study actually in amyloidosis. We don't often have very large trials in amyloidosis, and this was a very important study, the Tourmaline AL1 study, that compared using Ixazomib dexamethasone with really the physician's choice, or what was the preference for that individual patient. And those 2 strategies were compared, and we saw that the combination of Ixazomib and dexamethasone improved not only the response rate, but the time to next therapy, really almost doubling the time on therapy for patients receiving Ixazomib and dexamethasone. Patients with AL amyloidosis often have difficulty tolerating a lot of the agents we use in myeloma. So this is, I think, a very encouraging study, and we'll see more results from this over time. The second study was using Daratumumab with the combination of Ixazomib, lenalidomide, and dexamethasone in first-line multiple myeloma patients, whether or not they were going to stem cell transplant. This was an excellent study presented by Prashant Kapoor from the Mayo Clinic that was trying to build on the work that they have done using Ixazomib, lenalidomide, dexamethasone in frontline therapy. Now that we're so often incorporating Daratumumab into this strategy, we now see this combination of DIRD, where the IRD, of course, is an all-oral regimen, and soon we'll be using Daratumumab subcutaneously. We saw a response rate of over 95%, and it really did not impair the ability to collect stem cells, which is an important thing for those patients going on to stem cell transplant. So this will yet be another available combination to us in the future for frontline therapy. And lastly, I think a particularly important study was combining Daratumumab with Ixazomib and dexamethasone in patients who are really who are not going to stem cell transplant and frontline therapy, who were unfit and frail. We're learning so much more about frailty in hematological malignancies, and in particular in multiple myeloma, and this is so important. This is a real world study that was done by the European HOVON group. And it was very insightful to demonstrate that we can very legitimately combine Daratumumab with Ixazomib. Ixazomib is very attractive in this population of patients because it's easier to give and generally well tolerated. And we saw very good response rates and tolerability. There were some patients, the unfit patients, that can have some challenges of course, with early mortality in multiple myeloma, and we need to understand that a little bit more, the infections that they can have. But this was, I think, a very important addition to the options that we have for patients who are not planning to go to autologous stem cell transplant. So again, really extraordinary work here at the American Society of Hematology annual meeting, and we really hope that this is going to benefit our patients more and more, not only in the year to come, but in the years to come.